This presentation was given at the Irish College of Ophthalmologists annual conference in 2015, and it showed the results from an audit of cataract surgery in patients with astigmatism who were implanted with a toric intraocular lens. This type of lens is used to neutralize astigmatism and give good unaided distance visual acuity. The main objectives of this study were to assess the results and really to highlight the ease of the procedure in order to encourage other surgeons to begin using these type of lenses.
Alright, so just keep looking
This
dead
gives
straight ahead like that.
a video
Just make a
of
little
a
mark
simple
here.
marking technique used in the preoperative anesthetic room with the patient awake and focusing straight ahead at a fixed point.
We have the
You
horizontal
can see the
mark there.
horizontal axis marked. This horizontal axis is then used when the patient is lying down to give the horizontal mark on the astigmatism marker so that the correct axis of alignment of the new lens can be marked on the cornea. The methods in this study were simply a sheet was filled in at the time of the procedure and again at the final post-operative visit, giving all the pre-operative and post-operative measurements of vision and measures of glasses and astigmatism. 35 eyes were included in the study and all had insertion of one of either two types of lens, be it an Alcon toric lens in 21 and a Zeiss Asfina toric lens in 14. You can see the pictures. On the top is the Alcon lens and the bottom is the Zeiss lens, so they're slightly different models, but both have their axis marked clearly. The lenses are chosen in any patient with more than 1.25 diopter of astigmatism, and they have to be willing to cover the additional cost of the lens, which ranges from €250 up to €500 depending on the degree of astigmatism present. There are online calculators and a lot of preoperative measurements are put in on the online calculator in order to order the special lens. This picture on the right shows the Alcon calculator. The next one here is a slightly more in-depth calculator from Zeiss for the Asfina lens, and a printout is given at the end where you can check all the figures, and you can also print a transparency to put over the microscope, or simply a page to tape onto the microscope to show that you have the correct alignment with the new lens. So the results show that the mean preoperative refractive astigmatism was 2.74 diopters. Now, if this was present after cataract surgery, it would mean that the patient would certainly need distance glasses to attain the minimum standard for driving. After surgery, this astigmatism reduced to 0.7 diopters, which does allow good unaided vision. So this was a significant change. The shape of the cornea didn't change, so in other words there was 2.77 diopters prior to surgery and the shape of the cornea was unchanged at 2.74. So the astigmatism was corrected by neutralizing this corneal astigmatism with an intraocular lens placed roughly perpendicular to this axis. So the mean spherical equivalent, in other words the mean power of glasses needed, decreased from nearly 4 diopters down to less than half a diopter after surgery, again meaning that patients should receive good unaided distance visual acuity after surgery. The mean preoperative best corrected visual acuity was 6.12 prior to surgery, and this improved to 6.6 or 20/20 after the surgery. And the uncorrected visual acuity was very, very good at 6/7.5, again giving excellent driving vision without glasses. And when I compared the results from both types of lenses, the results were similar. So essentially the astigmatism was reduced to just around 0.75 diopters after the insertion of either type of lens, and this was significant. So in conclusion, these toric lenses, they're an essential tool in cataract surgery if a patient has significant pre-existing astigmatism, and a patient's chances of at least getting driving standard vision without glasses are much better if the astigmatism is addressed at the time of cataract surgery. If one of these lenses isn't placed, you really are telling the patient that they will need glasses after surgery to drive if they have pre-existing astigmatism. And the extra cost of these lenses, really, most patients pay around €250 for small degrees of astigmatism, and this compares with the cost of a pair of glasses after cataract surgery. So I usually tell them this and advise them that, they can either pay it before or afterwards for glasses or the lens, and most will choose the lens.